Hello everyone, my name is Raul Rios, and today I will be discussing the levels of evidence for evidence-based practice for research in health science. Sit back and enjoy. What is evidence-based practice, you may be asking yourself? According to Sackett, Rosenberg, Gray, Haynes, and Richardson, 1996, it is an explicit and judicious use of current best evidence in making decisions about the care of individual patients. The idea behind evidence-based practice is that decisions about interventions in clinical areas should be based on the strength of the evidence. An important aspect of evidence-based practice is that it should integrate research findings with other more subjective pieces of evidence rather than the use of research as the main source of evidence. The following is a pyramid describing the hierarchy of levels of evidence for evidence-based practice. The pyramid starts off with systematic review, evidence for one or more systematic reviews of well-designed randomized control trials. Critical appraised topics, evidence for one randomized control trial with a large sample size. Critical appraised individual articles, evidence from one or more systematic reviews incorporating randomized control trials and observational studies. Randomized control trials, evidence from randomized control trials with small sample sizes. Cohort, evidence from quantitative studies using quasi-experimental designs or comparative designs. Case control studies, evidence from qualitative studies and case reports. Expert opinions, evidence from expert opinions. Quantitative versus qualitative evidence. Quantitative research is viewed more positively than qualitative research. Qualitative research is seen near the bottom. The reason for this is that the classification schemes comes from a field of medicine where randomized control trials are viewed as the pinnacle. Internal validity versus external validity. Internal validity is given more weight than external validity. Studies with stronger internal validity are usually considered providing more valuable evidence than studies with stronger external validity. Multiple studies versus a single study. Multiple studies on a topic are viewed more favorable than a single study. The problem with single studies is that they have not been replicated, or when replicated, the results are not the same. To resolve this problem, meta-analysis was developed. What is meta-analysis, you may be asking yourself? Meta-analysis is a method to synthesize research on a topic by combining the results of many studies dealing with the study. Meta-analysis solves the problem by obtaining an overall effect size average indicating the degree of success or the lack of intervention. Large sample size versus small sample size. Studies with large sample size are rated higher than studies with small sample size. Given the appropriate size, there is less chance of error as there are more participants. There is also more statistical power and the power to reject a false null hypothesis. Problem with evidence-based practice. The levels of evidence in hierarchies evaluate the rigor and the design of a study, but describe little about the specific results of the study. Process of evidence-based practice. Sackett, Richardson, Rosenberg, and Haynes, 2000, suggest 5 steps in the practice of evidence-based medicine. Step number 1. Converting the need for information into an answerable question. The process usually begins with asking meaningful and answerable questions that are directly related to an issue of concern. After defining the question, the search for literature begins. Step number 2. Tracking the best evidence with which to answer the question. This includes relevant journals, recent texts, and electronic databases. Once the literature is searched and relevant articles are retrieved, the next step is to evaluate them. Step number 3. Critically appraising the evidence for its validity, impact, and applicability. There are many meta-analyses being published in most professional journals. When going over the meta-analysis, be sure to check the studies that are of equal value. Check for designs, as some meta-analyses have better designs as others. Check for improper use of statistical techniques. Be on the lookout for statistical power and poor external validity. Step number 4. Integrating the critical appraisal with the clinical expertise and with the patient's unique biology, value, and circumstances. After this has been accomplished, the counselor still must make the decision as to what extent is the information usable. Step number 5. Evaluating our effectiveness and efficiency in executing steps 1 through 4 and seeking ways to improve them for next time. How is evidence-based practice used in rehabilitation counseling? How to use research is a learned skill. With this skill, rehabilitation counselors can help ensure that their practice is based on the best evidence available. Evidence-based practice is a balance of using external research, based clinical evidence, and clinical expertise. The purpose is to show rehabilitation counselors how to build the skill for using evidence rather than just doing research. This involves asking questions, finding and appraising relevant data, and putting that information into everyday practice. When evidence-based practice is immersed into a counselor's daily routine, the result is a more analytical and ultimately effective clinical practice. Thank you for watching. Hope you enjoyed the video. Bye!